Once you're done with the inspection of the eye, you have calculated the visual acuity, the visual fields, you have basically detected any abnormalities in the pupils or the pupillary responses or in the light reflexes, may it be the direct or the consensual light reflexes. You have noted down any abnormalities over there. Then you're going to move on to the fundoscopy. So fundoscopy is basically examination of the retinal damage of the eye or the retina of the eye, in which we basically examine the retinal vessels, and then we also examine the optic disc. The healthy optic disc should be differentiated from any abnormalities at the level of the optic disc. The fovea and the macula that are present in the optic disc have to be examined in detail. Any abnormalities that are noted down on the fundoscopy should be noted down or documented by the ophthalmologist. So the fundoscopy is usually carried out. It has its particular prerequisites that we're going to discuss over here in this section, and then we're going to move on to the actual procedure to carry out this fundoscopy procedure. And then we have the observations, how are we going to note down these observations, what can be the different sorts of observations that can be seen when we carry out this particular kind of fundoscopy in the patient. So if we have a look at the normal anatomy of the eye, we've already gone through the different structures of the eye that are present over here, the different protective coverings. They include the sclera, that is the outermost covering. Then we have the choroid plexus, we have the retina over here, and that is what we're going to examine over here. This is the best place to examine retina. The fundus of the eye is the best place to examine the retina over here. The region where the optic nerve basically enters the eyeball is known as the optic disc, and it has this macula that is present right lateral to the optic disc. So we're going to examine this macula, this foveal region, this optic disc abnormalities if they are present in the retinal structures. So on the fundoscopy, you're going to examine these structures, namely the optic disc, and you're going to see the disc outline first of all. Then the color of the optic disc, it can be a pale color or the normal reddish tinge if it is present. The physiological cupping, if it is present or absent, has to be documented in detail. Then this is basically showing the instrument that is used for carrying out this fundoscopy. This is the filter switch that is present over here. Then we have the diopter dial over here. We have the aperture dial over here. And this is known as the rheostat that is present at the base of this head of the ophthalmoscope that is present over here. This is the normal structures that are present in the retina. That is the optic disc, which has this pale yellow color. That is a normal feature. This is the physiologic cup that is present in the midline. Then we have the veins and the arteries that are present in the retina, the fovea centralis, and then we have the macula that is surrounding this fovea. These are the structures that we have to examine while we are carrying out this fundoscopy. The anterior structures that are present while we are carrying out this fundoscopy are the retina, we have the vessels and the four quadrants. Then we have the fovea and the macula that is also present over there. Then we have the fundoscopy prerequisites. Lights are dimmed. First of all, hold and position the ophthalmoscope properly. Use the index finger to switch the lens. Examiner uses the right eye to look in the right eye. Inspects the anterior structures with the ophthalmoscope, that is usually the right eye. Inspects the optic nerve. Right eye comes in at 15 degrees with the lens. Traces vessels to all the four quadrants. So usually you divide the quadrants that you're going to see into four sections, and then you're going to see any abnormalities. Observe the macula of the right eye as well. Examiner uses the left eye to look in the left eye. Inspects the anterior structures with the ophthalmoscope, that is usually the left eye of the patient as well. Inspects the optic nerve of the left eye and comes in at almost 15 degrees again. So it's almost 15 degrees for the right eye and 15 degrees for the left eye with lens at 0. It traces the vessels to four quadrants, that is left eye observes the macula. So in the left eye, you're going to observe the macula, and in the right eye, you're going to inspect the optic nerve. So this is a strategy that you're going to apply when you perform the fundoscopy. Then if you see over here, this is the optic disc, this is the physiological cup, this is the normal pallor. The margins have to be noted down when you look at the optic disc. And during the fundoscopic examination, the ophthalmoscope may be used and to visualize the following structures, anterior structures. And in the optic disc, you're going to look at the disc outline, the color of the optic disc, and then the physiological cup if it is present or absent. Then you're going to move on to the retina. What are the vessels present in the retina? The four quadrants are discussed. And then we're going to move on to the fovea and the macula that is present in the retina of the person. The magnification power of the lens is observed in diopters. It is usually controlled by a diopter dial that includes the black or green numbers, positive numbers, and they are counterclockwise, and they are basically the plus lenses. Then we have the red numbers that includes the negative numbers, and we have the clockwise minus lenses that are present. So knowing these numbers when you're using an ophthalmoscope is very important. Light sources, the brightness is controlled by a rheostat. There are various apertures. Large one is usually, it is used in this one. We have a small one and small pupils, red free filter, that is the green beam, optic disc, pallor, and then we have the minute vascular changes that are seen over here. The slit, anterior eye elevation of the lesions are also seen over here. Then we have the grid, that is the size of the fundal lesions is noted down. So if we have a look at the procedure that is carried out, first of all, you have to darken the room, place the ophthalmoscope to 0 diopters and large round beam. Keep the index finger on the lens disc. Use the right hand for the patient right eye and left hand for the left eye. Ask the patient to fix the gaze on a spot on the wall. From about 15 inches away or about 15 degrees lateral, lock into his eye, observe the red reflex and then move in closer. You may rest your opposite hand on the patient's forehead above your eye. Move the ophthalmoscope very close to the patient's eye. If you initially see the blood vessels, you can follow the blood vessels towards the disc. They flow like veins. They flow like rivers towards the disc, and diopters may need to be adjusted to obtain a good focus in this way. So this is how basically you carry out this procedure. That was the literature, and here you can see that you have placed a lens over here. You have an ophthalmoscope in your hand, and you are having a good view at the retina of the patient, and you're going to notice everything that is possible, ranging from the blood vessels that are present on the fundus of the eye. The optic disc is examined in detail, the macula and the fovea. Any abnormalities that are present in the macula and the fovea also has to be documented. Now the observations include, once you see the disc, note its color, what percent of physiological cup involves the disc. Cup to disc ratio should be less than 0.6. The observations should be, note the size of the arterioles compared to the veins, should be 2/3 to 4/5 size of the veins. Next, look in all the four quadrants of the retina. Finally, look at the fovea and the macula, and is done by asking the patient to look at the light. So rather than focusing on something at the wall, you're going to ask him to focus on the light, and then you're going to see the fovea and the macula in the patient. So these were the highlights for the procedure of the ophthalmoscopy or the fundoscopy that is usually carried out, and what are the prerequisites and the basic steps for the procedure of the fundoscopy and the different observations that can be made from the fundoscopic procedure. So that is the end of this section. Thank you for watching sqadia.com.